We did it. We're back. We did it.
We gotta fix this.
I know. I need a haircut. You ready for it? You know who my barber is? Barberette.
Yeah, but we gotta fix that or something. I don't know.
What do you mean? Well, it's just getting long. That's all.
It's like stuck in this mode. Well, hello.
This is not what we're talking about today.
I got one too. Look,
we're gonna put some filler in there. We need some HA,
hello,
some
Emma,
Sheila, HA hair products.
Yeah.
Emma B.
Emma's coming in.
When are you coming in?
Emma's coming in. I think on the 25th or something.
Yeah.
Or the. Okay. Yep, I'm gonna see Emma. We got D Lynch over here,
right.
And we got some other people. I'm gonna be waving to you guys. Well, hello. Guess who I have here?
Yeah.
It's gonna be us talking everything you want to know about hyaluronic acid.
Right.
We got our products right here. We're gonna go over hyaluronic acid. We're gonna go over what to do if you don't like your results, and
what do you do if you like your results and want to like them even more?
That's right.
Yeah.
It just means more. And then how long it lasts and everything.
Okay, cool.
So, have you ever had hyaluronic acid injected?
Hyaluronic acid? No.
Okay.
Right?
No,
I haven't had. I haven't had any. I haven't had any filler yet, but I'm thinking about it. Like I have little tiny creases here, so that would be, if I was coming in for a consultation, right? This would be an area to get a little volume, and I need a little volume in this zone because this is starting to come in and collapsing. So a little volume here in this central malar point would be good.
So, hyaluronic acid, what is it, where is it, and what can you do to get it in your body? Well, you know what? You're born with hyaluronic acid, and your body produces it and keeps you at about 15 grams of hyaluronic acid in your entire body, and 1/3 of it gets replenished on a daily basis. Did you know that?
No.
Okay, and it's located in your joints, it's located all over your body, and it is especially located in your face. So when you talk about adding dermal fillers, you're just adding the same thing that you already are born with, just to help volumize
Yeah.
or rehydrate. So ways that can be done is injecting a filler. It could be with dermal products that you put in your skin. Multiple different ways.
Mm-hmm.
Yeah?
Yeah.
Okay.
Yeah, I totally agree. And I mean, that's why hyaluronic acids are so popular, is because they're compatible and it's what everybody needs, what everybody loses as they get older, or
Hey, Chelsea.
It's even though the term hyaluronic acid is not, nobody really runs around saying that so much, because it doesn't. So who's like acid? I don't want acid in me. But this is a gel. This is a gelatinous type product that is what we all need.
That's right.
I love my HAs. Yeah, HAs sounds a little bit nicer than hyaluronic acid, but so we all say HAs.
So there are 7 uses or main uses for hyaluronic acid. It promotes healthier and more supple skin, and that's because it's a hydrator. It actually has about 1,000 times the affinity of water. It can hold up to 1,000 times more than its molecular weight in water. So if you're applying it topically, you also want to apply it with damp hands to suck that water into the product, and then it goes into your skin a little bit deeper. I'm getting distracted by Emerald's comments over here.
Damp hands? Right.
Yeah.
Nice. I can say that 3 times in a row.
Damp hands.
It just sounds funny. Okay.
Anyway, it also speeds up wound healing. So I wonder if you can use that on wounds, but that's another thing. It relieves joint pain by keeping the joints lubricated. These are just hyaluronic acid in general. Soothes acid reflux symptoms. So if you mix it, if you take hyaluronic acid supplements, it does come in a pill form for those of you that don't know, with glycosamine and acid reliever, it helps better than you just use the acid reliever alone.
Oh.
It's a fun
So
fact.
it's like kind of lubricates the GI tract a little bit.
Yeah.
I guess, right?
Soothes it. Okay. It's used in ophthalmology. It relieves dry eyes.
Lubes and soothes.
It's often found in ophthalmological drops. It preserves bone strength by reducing the rate that you lose your bone. Look at that. What is that? Where's that? It's in the front.
Sorry. Get some hyaluronic acid.
Yeah. And then there's also thoughts that it could prevent bladder pain as well. So we have a ton of products, and all of our products, the majority of our products contain hyaluronic acid, and those are the reversible dermal fillers. So there are some fillers that are not reversible, but they generally do not contain hyaluronic acid. So some of the ones we have back here, it's Restylane family fillers are typically made with, I don't know if you guys can see that. So we have Restylane Refine and Define and Kiss. We have the Juvederm products.
Bring it closer,
I know.
right? So
you
take it off?
Sure.
I'm going to take it off. Hopefully I won't screw this up.
Okay. Whoa. Okay.
And
So
I'm going to spin it around. Hey.
I'm missing.
Hold on.
Okay.
Okay. Now.
I'm missing Refine in here, but that's Refine, Define, and Kiss.
Okay.
And
so
then,
talk about them. We got time.
So I kind of group them with the company, but also the stiffness of them. So you talk about fillers, you talk about the stretchability of it, and you talk about the compressibility of it. How well can filler, so when we, you see this big line of all these different products, how do we know which one to choose if we're injecting under the eyes or in the lips or the cheekbones? So,
all right, which one of these, right, is the best one for you? Is what she's trying to say.
Right. So we talk about fillers that are very stiff and don't allow the tissue to compress them. And you want them on areas that's going to mimic bone, the cheekbones, the nasal bridge, the jaw, the chin. You want a stiffer filler. And so that would be such as Restylane Lift.
This stuff's
I know, sorry. Restylane Lift. Or we talk about Volbella, not Volbella, what am I talking about? Voluma.
Mm-hmm.
That has a high, I don't have it here.
Oh.
I'm actually.
Are we out?
I'm missing that one and Refine, but we have got all the other ones. But, so we just use them up. What can I say?
Okay.
So anyway, those are very stiff. They do not compress well. They're great for against the bone. And the complete opposite of that, you want a filler that's very soft, and moves with the tissue and incorporates into the tissue well if you're injecting into the lips or under the eyes. So Refine, Define incorporates very easily and well into it. Also, the RHA brand does as well. And then there's some Juvederm, but they also are very, they suck water to them, and they're actually can cause a little orbital swelling, so I tend not to like them around the eye area.
Hydrophilic,
That's
right?
right.
They pull that water in.
They pull water. So
Okay.
depending on, and then we have ones that are all in between. So Refine and Define and Kiss are part of Restlane's expression technology. It has a lot of stretchability. It can stretch far without tearing or with still maintaining its shape. So that's very appealing for high movement areas, especially around the mouth and nose and lips. And same thing with the RHA brand. They do the same. So they're very good. They mimic natural tissue, and they're amazing for that. The other ones are all good for different purposes. Silk is very good for fine lines. You don't want you want it to fill that fine line rather than, still continue to see it afterwards. So there's multiple different fillers. The point is there's multiple different fillers on the market now that can treat really any issue that you may have in the face. So we pick the one that would best suit you, how deflated you are, how much plump you need, and the area of the face that you may need restoration of. So with that said,
Okay. What about
Yeah,
using some mix of these, right? I know a lot of times you're not just using one. You're using a little bit here, a little bit there, and I guess it all depends on where you're putting it in the face, right? So if somebody comes in and they're like, okay, I want my under eyes done, and I want my nasolabial folds, or I want my lips, and you're thinking like they need two different products. But they may be like, hey, I can't get two syringes, like.
Right, so I'll explain that to the patients that if they really want their cheekbones done and their lips, you can't really use the same filler. So, you have to use a much stiffer filler for the cheek area than you do the lips. The lips really need a very, very soft filler. I could use the same filler for, say, the lips and the nasolabial folds, but not if they want, you can use the same one. You just have to use smaller quantities and smaller increments in the lips, but they can kind of be interchangeable. But for instance, around the eyes, I'm going to use a very, very soft filler, one that smooths the area and incorporates into the tissue well for that area. So you just have to know what area and look at the patient's skin. So on somebody that's super, super thin-skinned, you have to be very careful. So I had a friend, she's got very, very thin skin, and she had, temporal wasting and needed filler injected in her temples. She got a very stiff filler because they're like, okay, let me mimic, she went somewhere else. And they said, let me mimic bone. So I used a very stiff filler on her, but because her skin was so thin, you could see all the lumps here. You could see every place that they injected. So that's not really a great choice of filler. I personally would have used a much softer filler, one that maybe mimicked the soft tissue underneath, overlying it, rather than the bony prominence on somebody like her. But somebody who's younger, who's got very thick skin, you could use a stiffer filler on. So you have to know the patient and look at the skin quality and how dense the skin is and thick the skin is before you choose one. An older patient, you want a very soft filler in the lips. One of, maybe Refine or Kiss or RHA2, in the lips. Silk is softer in some aspects, but then it can also cause some lips to actually have almost kind of like an allergic reaction. Lips can blow up. That happened to me once when I had them done. They were like huge. It takes a little bit to go away, but
they're all 1 cc syringes. Are they all?
Volbella every now and then will get in a 0.55 syringe, but all of them are 1 ml except for Radiesse, which is a non-reversible, and it's not hyaluronic acid. It's hydroxyl apatite, and that one is non-reversible, and that comes in a 1.5 ml.
Sitting in the back back there.
Sitting in the back. So we're talking about hyaluronic acid. But I just want to bring it out for completeness. For that.
Right, and so all these are reversible agents, which makes them attractive because if you don't like it, you can easily have it reversed. The only one that's not reversible is back there, that Radiesse, which kind of mimics bone because it's calcium based, and it's a great filler for especially around bony prominences, but downside is it's not reversible.
That's right.
Someone says, what are the prices for all these fillers, and do you guys have a payment plan?
So we accept Care Credit and Alpheon, which is a financing companies. They range in price from $650 to about $800
per syringe,
per
right?
syringe, depending on which one you get.
And just the payment plans for Care Credit, there is a minimum that you have to spend on it, right? You can't just use it for like $200 or something, right?
The minimum is $1,000. So
okay.
some people will get it when they get their Botox. They'll keep the remaining difference as a credit at our office.
Got it. Okay.
And then the next time they just use that credit. We also have products in our YovinoMD skincare line that contain hyaluronic acid.
Oh yeah, let's talk about those.
So on top of, when you get injected to restore volume, we also have our products that can help increase the life of your filler. So our filler in a bottle contains 4 different sized molecular weighted hyaluronic acid. And what it allows is penetration of all the different levels of the skin to hydrate all the levels of the skin. So this one's great. It can help increase the life of your filler. And it is pure hyaluronic acid. Perfect. It's a perfect hydrator. It's great also if you're going somewhere with a very, very dry climate. You know, every time we go to like Mammoth or we're up in the mountains or we're skiing or
Burning Man,
you're super dry.
Yeah.
This one's great. It gets your chapped lips cleared up in a minute.
You want to show it? Squirt a little bit on my hand.
These aren't opened yet. There are.
No?
Okay, but here.
Well, they are now.
So you're gonna want to.
Can you rub it in? I mean, seriously.
Dr. Justin. Okay, so
don't get excited.
What you want to do is you want to actually get your hands a little bit moist before you rub it into the skin. I put a lot for such a small little area, but you know, even on my dry skin, you can see my arms are a little bit on the drier side, and then you can see them.
Rub it on you.
So it really helps rehydrate nicely.
Yeah, it feels good. I mean, can you maybe finish? I only have one hand.
Okay.
It's good. Someone's asking, are we able to put them on our lips? I think you're talking about the filler on the bottom. Absolutely.
Yes. And then we have our tinted sunblock. That is a mineral-based sunblock that contains just zinc and titanium. It's great for all skin tones. This is also a hyaluronic acid-based one, so it will hydrate you when you're out in the sun as well.
That's got hyaluronic acid in it,
HA
too.
Defense.
Look at that. I guess I didn't realize that. HA Defense.
And then we have our Wrinkle Erase Serum that will increase your collagen and elastin by about 180% each. And this also contains hyaluronic acid in as well. So those are our 3 products in our line that contain it. We have pure hyaluronic acid and then hyaluronic acid that's added.
Is the other one open? Is the HA Defense tent open or no?
Nope.
Oh, man. Okay. I was
So,
going to say squirt it out, but no.
Yeah, it's not. Okay, so the next thing we wanted to do is talk about, let's do some questions.
Okay.
So do you want to put it here and we can both answer them together?
Sure.
Okay, so we're going to answer some common questions that people ask us. And if you guys have any questions if you guys have any questions, feel free to ask us in the feed as well. Oh, are we able to put them on our lips? Yes,
Yeah, we
saw that one.
Okay.
Okay, we're caught up?
Mm-hmm.
Okay, perfect. Okay, what are some lesser known areas to get fillers? Dr. Justin, you want to answer that one?
Hands, right? Hands is off the beaten path, right? So fillers are on the back of the hands here.
For wrestling lift.
Okay, all right, but it's the lesser known areas. The nose, right? I mean, if you follow Dr. Sarah, you'll see that there's a lot of non-surgical rhinoplasties that she does, but it's not the typical area like a smile line, and so I'd say that's an area.
So one common question that people ask me is, so they're questioning whether or not a non-surgical rhinoplasty would be good for them. And, for somebody that has a bump in the center of their nose, but their nose is a good width, then they would be a good candidate for filler in this area, because it can really change the overall shape of the nose by putting filler centrally. Very rarely do I put filler, I should get actually one of these out, hold on. Very rarely do I put filler, you can just face it, it's fine. Around in this area, like on the nares or the sides. I have done that before, but it is rare. Typically when people get it, it's right here at the radix. You can see with Dr. Justin's nose, can you turn totally sideways? So if he came to me and wanted it done, can you take your glasses off for a second? Okay, so, this is a very common area to be injected. And then if you also notice, his tip kind of droops down slightly. So I would put a little bit of filler here to elevate the tip or give him a supra tip break, which he doesn't have. He's kind of lost it. He actually has the opposite right here. And then I usually inject a little filler here to raise the tip. So the tip goes up, a little filler here to kind of give him a cute little nose. I mean, I wouldn't do it in, him, but, and then filler here. But if he had a very, you want to look at the thing? If he had a very,
I'm sleeping.
if he had a very bulbous tip, I wouldn't be placing filler there to make it look smaller. So I'll turn people away and say, you know what, you're not really a good candidate for that. If you really want your nose more narrow, then you're gonna need a conventional rhinoplasty. So filler is really only good for somebody that needs like reshaping to some degree, and if their width isn't too big, they're a good candidate for that. Yeah.
Okay. Yeah.
Also, it's not like it's free of side effects or danger. It's a very vascular area, so keep in mind, make sure you go to somebody that has done them. If you're living outside of California or you're away from here or you have somebody else that injects you, go to somebody that has a lot of experience. You have the facial artery. You want to turn it a little bit side? So you have the facial artery that comes like this, and then it splits into superior labial artery and inferior labial artery, and then it comes up here in this like tortuous way, right here at the edge corner of the nose, and then comes up like this, like that, and right to the eyeball. So be very, very careful. You need to go to somebody. This is when you don't go to fillers, or you don't go and get fillers in somebody's like house or garage, because they can blind you, and they can blind you very easily. And any injection in this area needs to come with caution. So be careful and make sure that they have reversal agent on hand. That's extremely important. And in a minute, we'll go over and show you what reversal of fillers looks like. But you want to keep that in mind. So especially if you've already had a rhinoplasty and you're coming for like a little bit of fine refinement, you need to be very, very careful, because you've already had compromise to some of your blood supply in that area, and you need to be careful with somebody injecting filler in that area as well. Okay? How do you determine if someone's a good candidate for fillers?
Well, it depends. First, what they are coming in for. I always ask them, what's bothering you? This is my smile lines here. Well, do they have a crease? Do they have a wrinkle there? Then boom, yes, they're a good candidate for it. Do they also think that it's completely going to go away and make them look like they're 20 years younger? Well, that might not be the case, and they have to have some expectations that are also in line with what we can do. So there's a bunch of things that kind of come into play to figure out if they're a good candidate. Most patients are a good candidate for something, right? Mm-hmm. For some sort of filler somewhere. They just have to understand what they're getting into and what the outcome is going to be. And then as long as they understand that and they're on board, then boom, we go.
So for me, if somebody comes in and they're older and they have a lot of facial volume loss and they need a lot of correction, and I can kind of start ticking in my head, okay, they need a syringe for this, they need this, I'm starting to add 5+ syringes to get them to where they want to look like, reverse themselves by 10 years or so. I start thinking, okay, well, maybe dermal fillers isn't a great option for you. Let's look at something that's going to give you a little bit more permanency or longevity. So the two options there are going to be something that's going to build collagen rather than just fill space and then slowly break down, or maybe even fat transfer. So the thing that's going to build collagen is Sculptra. So I know, you want to get that book that's in the drawer right there? Sculptra's a great option for somebody that has a lot of facial volume loss, because it will restore the volume. And I'm going to show you guys a picture. It's going to restore the volume nicely. So I'm going to show you this one. So here's a woman. This is what she looks like to start. And so she's 50, so 5, or something like close to 50, so 5 vials of Sculptra to get her where she wants to be. And so here's after, 2 vials in the first session, and then here's the second one, and then here's her third session. So it's a very natural looking result. I don't know if you guys can see that. It's a very natural looking result with Sculptra. So depends on how much volume loss you have in your face. You have the same book. Okay, so and then fat transfer.
If I came in, it's Sculptra, which would be I think the number one recommendation to build collagen in this area for me, as opposed to putting hyaluronic acids, which is an option.
You're talking about for yourself.
Yeah, for me.
Well, because you're,
for me, yes.
Okay. So Sculptra is great for men and women, and for Dr. Justin, if you look closely at him, you can start to see his nasolabial folds here. I don't know if you can see this. Actually, light is making you look great.
Oh, thanks.
Okay, but nasolabial. Yeah, you can't really see yours right now. Did you put foot in the bottle on? What?
There you go. Let me fire him up.
But he's lost a little bit of volume here in this area. So, Sculptra would be a good option for him because it's a very natural look. Okay. Can fillers be used to help a gummy smile? Yes.
More Botox than it is. Well,
so
fillers in the lips, right?
So 2 things for gummy smile.
I'm not doing anything else.
Two things for gummy smile. One is a little bit of Botox right on the edge of, right above the vermilion border can help soften the lips and round them out a little bit and drop the lip a little bit so you don't see as much of the gum. And the second thing is, what's the volume of the pink of the lips? If they have if it rolls in and you don't see any lip anymore, then you need a little bit of volume in the pink. So that would be filler.
All right.
Hey,
so
Jose.
Here. Sarah's always like, yeah, you get a little bit too much gum, right? So for me, I get, if you had a little relaxation of the lip here, that would take it, and if I had a little more volume there, but or you reduce the jaw. Right?
So another common reduce the jaw.
Yeah, you could take this in.
Then you're
like
crazy. He's talking about surgery, crack and move it.
Crack.
Who wants to do that?
Nobody.
Crack is whack. Or wasn't that what she said?
Something like that.
Yeah. Okay. I have a lot of patients that work out a lot. They may work out 5, 6 to 7 days a week, and they are concerned that fillers don't last in them. I get that a lot. Fillers don't last in me. What can I do? There's Ashley saying she loves her lip flip. I don't know if we got before and afters, but if we did, we should show you guys Ashley's lip flip. Hopefully we do have that. Okay, so for patients that work out a lot and feel that their filler doesn't last, what are the options for them? So say it's injected in their lips, right? Mm-hmm. So there are some fillers on the market that will last longer than the conventional 6 to 9 months or up to 1 year. And so those are the ones that are more highly cross-linked. And which fillers are those? Those are the Juvederm Vicross technology, and that's Volbella or Velour. Or
nice, it kind of spun around.
Yeah, this is the kind of new packaging. But so here's Volbella, Velour. So Volbella is great for somebody who's older and needs very soft, relaxing.
Because we're doing it backwards, like nobody's gonna be able to see.
But they know what it is.
Yeah, no, you know what it is. But I think it's better if you can read it, right? So
these are highly cross-linked. And last much longer. They last 18 months to 2 years. Same thing with the RHA 2, 3, and 4. They do last up to 15 months. They say 15, so it's going to be somewhere in that range, give or take a month or 2. So these are the products that you're going to want, or you think about something like Sculptra. But if you're talking about the lips, you can't inject Sculptra in the lips. So your only option is one of these 2, or you look for something more permanent. And that's where Dr. Justin comes into play. The more permanent filler is
fat transfer.
Fat transfer.
But now, so why wouldn't someone just always get this, right? If you're like
fat transfer?
No, why wouldn't you be like, I want the one that's going to last the longest, the most resilient to working out, and all that. Why get anything else?
That's a very good question. some of the Vicross technology, although they are highly cross-linked, they are associated with inflammatory responses. So if you haven't been vaccinated yet, you may want to consider not getting these for, that's my...
Is that a real deal? Is that a real issue?
They say it is.
They say, but that's not...
Whatever, it is. I mean, just get the Pfizer, I guess. But, the RHAs just came on the market. So we're one of the few practices in Beverly Hills that carries it. It might not be in your area, so you might have no choice but to get one of the other fillers. But some people get stuck on the filler that they have always gotten, and they may love the filler that they get, and they may only want to get the filler that they get. So typically the ones that last longer do run on the more pricey side compared to the ones that don't last quite as long also.
Okay.
So keep that in mind.
Everything's got lidocaine in it too, correct? Everything here.
They're all mixed also with lidocaine, so as you get injected, it does numb as you go along. But with that said, one of the questions was, or somebody had mentioned that they really wanted to get their lips done, but they're scared of the pain. Well, we have perfected the painless lip aug, and so I'll do dental blocks on the patient and numb out the lips so they don't feel the actual poke. And then afterwards, since these fillers contain lidocaine, they have extra long-lasting
numbness,
numbness
right?
that can last a little bit longer, and it can be more comfortable.
Usually going to last a couple hours, right? They leave here and it's going to be kind of lingering around for a couple hours, just like going to the dentist and you get a dental block, right?
Well, I find that the dental block typically once they get at the beginning of the procedure, and by the time they're leaving, it's slowly coming back, a little bit, and then it's fully done and out of their system by 2 hours. So just plan ahead. Don't go and plan a lunch meeting right after you get fillers. You're gonna have a hard time eating.
Yeah, right. You'll be drooling.
Okay. So what's another one? Another thing people ask is if they keep getting fillers and they keep injecting, will their face get all saggy afterwards? Like what happens when the filler dissolves? Like will their lips deflate and will they look like saggy bags? Saggy bags. It usually is not the case. I mean, I haven't had anybody inflated to such a degree that it causes any issues.
No, because it's not an expansion. It's not like massive weight loss where you're dropping 50, 60, 70 pounds. I mean, these are not even, I don't think that's an issue.
And if your face has gotten so big from doing dermal fillers that it's sagging,
we don't really want to see you here.
I think you've got some bigger problems going on.
Yeah, right. Yeah, that's a different practice.
But yeah, so that's it's not going to happen. What if I hate my? Well, I'll leave that one for the end. What if I hate my results? Kind of reverse it. Do fillers damage or dissolve facial bone?
No.
Okay.
Listen, let's pick it apart, right? If you have a chin implant, right? This is not a filler, but you put in an implant that sits up against the bone, or you put in cheek implants and they're sitting up against the bone. Long term, they can cause some bone resorption, right? So it's not unusual to take out a chin implant and you can see some kind of notching where it was sitting up against the bone. So there is some resorption with things that are placed up against it. I don't think it's significant at all with fillers that are placed along the bone. So technically it might be a little bit of resorption, but I don't think it's significant to even pick up.
And naturally, your bone does resorb as you age anyway. I mean, it's not going to be like notching, but...
You can point it out on me again? Yes. So this bone is slowly regressing. And so that can make the nasolabial fold look a little deeper. Not just by deflation here, things kind of drift down.
So another thing that's really popular right now is that hyaluron pen. Have you heard about that?
Mm-mm.
It's a pen that contains hyaluronic acid, and you can see it all over Instagram. People are holding it to their lips and they're injecting hyaluronic acid into the skin. And it's a pressure, just by pressure. There's no needles.
Okay.
So some people wonder, well, what are the results of that? So you have to think, so it's really how far can you get that hyaluronic acid into the skin when you're using that kind of pressure? You're never going to be able to get it. First of all, you're not going to be able to get it that deep. It's associated with extreme bruising, and sometimes the bruising takes longer to go away, and then by the time it's gone, the results of that hyaluron pen are gone too. And it's extremely painful. So, and also...
Is this stuff sterile?
I'm not sure.
Like, how do they get... That sounds
I don't know.
Sounds dangerous.
But also, you have to think that it's very unpredictable how it goes in. So it's, you see people and they're very lumpy afterwards. It's very, very difficult to strategically place that hyaluronic acid. So keep that in mind. I wouldn't recommend it. It's an no for me. Okay?
It's a no for me.
It's a no for me. So what are the best for under the I'm about to poke you in there. For under the eyes? I personally like to use a cannula from, out in this area and inject with a cannula up in that deficit around the eye. A cannula just spreads the tissue as it goes in and injects the filler rather than a needle. A needle could cause a lot more bruising. But so there's many different techniques. Some people go straight down and they inject right on the bone. Used to do it like that.
Yeah, I mean, it's all about staying deep here, which there's not a lot of room, right? I mean, this is the thinnest skin in the body. You grab it, you can feel there's not much there at all, and then the bone's sitting right underneath. So it's super thin, but you want to lay down product as close to the bone as possible. So there's a lot of different techniques described. When I was first doing it a long time ago, is injecting straight in and essentially touching the bone and just putting little micro droplets. And that's a good technique because it's placed deep, but there is multiple puncture sites. Not the end of the world, but it does cause some bruising. The cannulas are great, and we use those with fat transfer because of the size. And I remember
a track of little red dots too that take a little bit to go away.
But the cannula is nice because you can also get very deep, and it's not sharp at the tip. It slides easily, so it doesn't cut any of the tissue going inside. Essentially, you just need a little cut in the skin, and then once you're through that, then it's just sliding through the tissue, placing it very deep along the bone.
That's right. So some patients come in and they have a very asymmetric face. They come in for jawline filler. One jaw looks nice and chiseled. The other one's a little bit like smooth. Everyone's like, I want Dr. Justin's jawline. They come in here and they're seeing this thing, and they want that jaw.
Just Jesse.
So, it can take a lot of filler to get a chiseled jawline. So when you see these people on Instagram, they're getting a lot. Hello, everybody who just joined. So we're talking about dermal fillers, hyaluronic acid. So injecting of, the jawline is very common to give this nice chiseled jaw appearance. Some people don't like it. They feel like it makes their face too wide. That's typically the women. They feel like their face is too wide and like too fat. And then we inject the chin. We can square off the chin or make the chin a little rounder, depending on whatever you like. And I have some patients that come in and they have, just like Dr. Justin does, has this little cleft right in the center, and they want to keep that cleft. So we inject strategically to square the jaw, but to keep that cleft. So you can, play around with it and do all this other stuff. So what if you get all this filler? What if you get your lips done and you hate it? You just don't like it. What's your option? You can wait the 6 months. Depends on the horn.
Yeah, it depends on what you don't like about it, right? Because, so it's always best to come back in so we can see you and look and talk and find out what's actually bothering you. Maybe it's something that is, doesn't need to be totally reversed, right? Maybe you can wait on it. Maybe it's just a little bit of swelling that's associated with it. It all depends. But if you truly don't like what the end result is, then there's an answer.
Kim's right. We can reverse it. We can fix it. So sometimes when you get your lips done, you may have a superficial bump, or you may have unevenness, or you may have filler migration, which you'll see up in this area. You know, it's a very thick and full area. You see that with certain fillers more than others. In this area here especially. And I have had a couple patients where, you know, their filler migration's right underneath the lower lip. Not as common. It's much more common with the upper lip for some reason. But there is hope, and that hope is called hyaluronidase. So in our body, we naturally produce hyaluronidase, and what it does is it breaks our own hyaluronic acid down. And they have taken this out, replicated it, and made recombinant DNA hyaluronidase, and it's called many different brands, and our brand that we have is called Hylenex. So
this is where, like, if we were really savvy, the Tears for Fears song come on, break it down again. You know, this would be the time to play it.
No, I don't know if I know that song.
But yeah, Kim was right. The answer was you gotta go to Sarah to fix it. Yeah, that was the answer. What do you do if you don't like your lips? You go to Dr. Sarah to fix it.
So we do correct and fix a lot of people's lips here. And then if you want to turn here.
Yeah, so I'm gonna grab the camera here so we can show some of the hyaluronidase. Let me just spin it.
Can you see? We're going to bring it right over between us. Mm-hmm. I got him trapped.
Yeah, it's underneath there, kind of. That's good. I mean.
Yeah, I'm kind of stuck, huh? Okay, so I'm going to bring it. Here we go. Okay. So I'll put the gloves on to look professional. And then... So what we're going to do, and I'm going to show you what the filler looks like injected. We're going to use Volbella. Remember, Volbella is a very soft filler, and this is by Juvederm, the Juvederm line. It's a soft filler, but it's very highly cross-linked. So keep in mind, if you have one of the fillers that's supposed to last a long time, because it's very highly cross-linked to make it very durable and last, it could take a lot of reversal agent to dissolve it. So this is our reversal agent. It's called Hylenex or hyaluronidase. It is used for multiple different things. They use it actually for retrobulbar injections in the eye for ophthalmology. And they use it for all different kinds of things. We use it here to reverse filler. So there also is talk that, very, very low chance of an allergic reaction to this medication. It's 1 in 2,000 people may have an allergic reaction to it. And I have read reports that if you're allergic to like stings, like bee stings or venom, then you could have an anaphylactoid reaction to this product. I don't know, I had read some things, but the American Academy of Dermatology kind of poo-pooed that. So just maybe you want to use it with caution. Another thing that's to keep in mind is they say that, was it this one? Hold on, let me just look really quickly. The one thing with hyaluronic acid that I found interesting, especially with if you're taking supplements, because some people do take supplements and things like that, is that it has been shown that it can sort of fuel the fire for cancers. So if you have an active cancer or has a history of cancer, you don't want to take hyaluronic acid. You want to be very careful using that.
Wait, okay. The hyaluronic acid?
Hyaluronic acid, yeah. So I read that in multiple different reports online.
Wait, if you're saying that if you got cancer, then...
Don't take hyaluronic acid supplements.
Oh, like oral stuff. Oral.
Pills.
Okay, sorry, I missed that.
I know you only half listen to me.
I was thinking of injectables. I'm like, wait a second. Hey, I got cancer, you can't get injectables? That's some BS.
That's some BS.
That's some BS.
So this is Volbella.
So let's show a little slow here, because... all right, what you got here? So this is Volbella. All right, so this is which one of the products?
This is the Juvederm line.
Okay.
I'm going to just show you here so you can kind of see what it looks like coming out of the needle. Oh, see how liquidy it is? Can you see that?
Yeah.
but it's very highly cross-linked. So
Get it.
see?
So this is a 30 gauge needle that you have on there, right?
32.
That's a 32, so even smaller. It's typically the Botox needles.
So do you see how when you lay it down, it sort of, it's not super duper duper stiff. It's really still kind of soft. You can imagine that in your lips. You see that? It's almost like liquidy.
Mm-hmm. Interesting. So this one is Volbella.
This is Volbella.
Vol.
Should I open up another one?
Wait, and this is one that you typically place in the lips.
I love this one in the lips, especially in an older patient. I love this one.
Why?
Because this one goes in super naturally. It plumps enough, but not like, you don't look like you should be twirling around a pole or anything.
Whoa.
But it's very natural. It is perfect for somebody of advanced age. It goes in nicely. I like this one. It lasts a long time. No one's really complained after getting this. They end up saying that they love it. I really like it for the lips.
And this is Volbella.
That was Volbella.
Volbella. Part of the Juvederm line. It gets a little confusing. Everything's Juvederm.
Yeah.
Here
so you
it
can
says
see Juvederm Velour, Juvederm Volbella, and then Juvederm Ultra. So when people talk about, I want Juvederm, they're usually talking about this Ultra right here, but they're all Juvederm. Okay?
Okay, which one's this?
This is the hyaluronidase. This is what's going to cleave the bonds.
This.
Right. So that highly cross-linked hyaluronic acid that we just injected right here, this hyaluronidase is going to cleave the bonds that holds it together, and it's going to dissolve it. And then what happens is it opens up the lymphatic channels and allows your lymphatic system and your vascular system to come and take it away. So I'm going to inject that here.
Let's see. Hold on. Let me come in here so you can see. Kim says, "Hey, I like twirling." And you made your, poll comment.
So I'm going to just inject a little. Oh, so I injected a lot. Hold on. So I'm going to show you what it kind of does.
But I look like it kind of took it down there, huh?
Yeah. So within 48 hours, all of this is the lymphatic channels close, and most of this is all absorbed. But you can kind of see here. Let me try to stack it back up. Get some more in there.
I mean, it works pretty quick. I know when I inject patients, look at that.
See how liquidy that is?
Yeah, right? Boom. Gone. Yeah, we noticed that when you inject an area, it really responds very quickly. I mean, really within 24 hours, most patients are like, "Oh yeah, it definitely worked. It's much better." Or even sometimes in the evening, because as you can see, if you get it right on the product, it just kind of takes it down.
Yeah, it's like, where's the product now?
Where'd it go?
So.
Okay, enough playing around there. You're having fun, I can tell.
So
you forget we're still alive here.
Yeah. So this can be injected really anywhere to dissolve product that you're unhappy with. The most important thing is when you talk about dermal fillers, and if you're a little iffy on it, don't let anyone inject you with a permanent filler, or a filler that's, no, I shouldn't say permanent, a filler that's non-reversible. So you're talking like the Bellafill or the Radiesse. Here's Radiesse or Bellafill. They're non-reversible. Always make sure that it is a reversible product. Also, just in case they get it, it gets injected, by accident in a vessel or somewhere else, and there's some issues going on, you want to be able to have a rescue medication, which is this hyaluronidase, to go ahead and break that down. So remember, your body already contains some of this. It already contains hyaluronidase. So that's what happens. It eventually breaks your filler down over a long period of time. But if you need to have it reversed quickly because you don't like the results, then you're going to want to use, a hyaluronidase or, injected.
So you stopped by saying this is not a permanent filler, but this is a non-reversible filler, because all these are absorbable fillers, but some have reversal agents and some
Right. Eventually, you absorb all of them. You know, you will eventually break this down. But this one is also very good for other purposes. Like if you really wanted, this one's also a biologic. So if you want to stimulate new collagen synthesis, none of these will do that. They'll hydrate you very well, but they're not going to stimulate new collagen synthesis, where this one will. What?
Well, I mean, some. I mean,
No,
there. You know, when you inject anything into an area, you form scar tissue. Scar tissue's collagen, right? So technically,
this is a biologic. This is going to. This people are diluting, and they're injecting in the neck lines. We're injecting it in the face in hyperdilute quantities. We're injecting it for crepiness around the elbows, the knees. You know, anywhere where you feel like you need a boost of collagen. This one's great for that. But this one is also great for the jawline since it comes in 1.5 mLs each syringe. So you're going to get a little bit more,
you know. Boatloads of it.
You're going to get more. But it's non-reversible. So keep that in mind. You don't really want it injected in areas, you know, where you can't really reverse it. Unless you've been going to the same person and you love the results that you've always gotten and you're comfortable with the way that they inject, then it should be enough, you know, it should be fine.
I was saying I had somebody.
You want to turn it around?
I had somebody years ago, kind of early in my career, where they came in with fillers, I think somewhere in the face, and they didn't like it. This was done by somebody else, and they said that, oh yeah, it definitely was Juvederm. I mean, they were like, adamant, 100%. They knew it was Juvederm. And so I said, okay. And we injected hyaluronidase all in the area, and then a day or 2 or 3 later, she's like, it hasn't changed. It's still the same. And I was like, all right, well, listen, it's got to work if it's hyaluronidase or hyaluronic acid. Get the reports from the other place if you can. She got it. It was Radiesse. So Radiesse is not reversible, right? So any injection of a reversal agent won't do anything for it. So you got to know what you got, okay?
You want to just put it right there?
Yeah, sure.
Was there any questions? You guys have any questions? We see there's a few people listening.
Let's come in here. Yeah. Oh, shit. Yeah. What's happening? I don't know. I hit something.
So anybody have any questions here for us? We are ready to answer them. Any questions related to dermal fillers?
Were you going to show
reversal agent?
No, so I'm just going to touch.
We just got some muscles of the face.
Touch this. Oh, yeah.
Oh, you talking about me playing with it? Yeah.
It's it's essentially liquid now. Done. Melted away.
Kim's saying, just go to Dr. Sarah first. That's right, Kim.
We can put this on the skin, huh? It's hyaluronic acid, right?
There shouldn't be that much left over.
No.
Yeah.
But it breaks it down. Break it down. Okay.
So, what else is going on? Tell us something new. So, why would somebody go and get this and not do fat transfer? Or when do you do fat transfer instead? So, this is your temporary fillers. If you're, want volume in your face, but there's permanent options out there, and that's fat transfer. So, I know we're not supposed to be talking about that, but we got Dr. Justin here, so.
Well,
might as well
can talk about
brain.
So, if you're doing body sculpting and you're removing the fat, like you want your arms thinner, you want to get rid of the pooch in the abdomen, the love handles, whatever, right? It's always good to consider using the fat to transfer to somewhere. In common areas of the butt and the breast, but the face is awesome for around the eyes and the smile lines and the cheeks. A lot of times it is this zone which is really great for fat transfer. And positives with that, it's your own tissue, you don't react to it, it's permanent. Negatives, it's a little unpredictable because how much you put in is not going to be the end result. You're going to lose some. It's usually around 50%, can be more than that, can be less, so there is some unpredictability. There's always an improvement, but it may not hit your sweet spot. It may take another round of transfer, or it's just put you up a little closer to your sweet spot, and then you use some fillers to kind of tweak it even further to get it there. So
one thing I need to say really fast is that I forgot to mention that the 3 products that we have that contain hyaluronic acid are 20% off for the people that are watching live, and that's HA20. Use that code on YovinoMDskincare.com.
That's my favorite, the filler.
But one thing I want to ask is that, okay, so some patients want their lips permanently filled, so they want to go ahead and do fat transfer. Is that all that they need? Will it give them the lip that they want? I mean, what's your experience with that?
Usually it's a subtle boost. Even when there's a lot placed in the lips, it's a subtle enhancement. And they're happy, but they usually want a little bit more. And so they still are candidates for fillers, but they don't need as much filler, right? And they may not need it as often. So it just establishes a better baseline.
But what doesn't it address when you inject the fat in the lips? What doesn't it?
Like some of the fine lines, yeah, the superficial. So you can, with fat, it's hard to get real close to the skin because it's, albeit small, it's still thick, and that dermal, right in the dermis, the dermal epidermal is really tight, and so I think the hyaluronic acids still reign at that level. They're easier to use, they're more consistent. You know, you can put it right in there as opposed to fat. You can't. You gotta really try to show.
Like you can't really get the vermilion border definition if you do fat transfer.
Right.
But you can add more to the pink part. So if you really need, and it's more of a permanent fill, and then you just, if you need to, you can tweak with the fillers to give you more precise work. The fillers can also be split. You can use a much, finer one for the vermilion border if you need vermilion border work, and then use one that is a little plumpier for the lips as well. That's really anywhere in the body. And also the technique of injecting, we've realized that there's different techniques to inject. Like if you want the nasolabial folds, instead of injecting up the fold like this, if you inject perpendicular to it, you need like a fourth of the filler to give you a very natural looking result, because you're essentially this crack that you have running down that fold, you're supporting it this way and lifting up and creating this bridge across. So you could take one syringe, if you're not super volume deficient, and inject both nasolabial folds and your marionette lines, and it can look great with just that, rather than, oh, you need a full syringe, and then this needs something itself. So things have changed. Oh, can
filler or fat transfer be used with Botox lip flip?
Yes, it can. Botox lip flip can be used with really anything. So if you've already had fat transfer, or you've had filler in your lip, you can use, you can do a lip flip. The lip flip is just Botox or Dysport right along the border here or right underneath the lower lip. And what it does is it just prevents that pursing and rounds the lip out. So for people that are like, you know what, I want more fullness to my lips, but I'm afraid to do filler, what do you recommend? We can certainly inject some Botox around there, to give you an appearance that you have more volume in your lips without actually adding more volume. And can you combine to use all YovinoMD skincare, or should some products not be used? Well, definitely the ones that contain hyaluronic acid can be used. Oh, we got Heather. Hello, Heather. You can use any of the ones that contain hyaluronic acid to boost your filler longevity and results. So I think we answered most questions. We actually have less than 2 minutes remaining. Any last minute questions, we are here to answer. We are also available for virtual consultations if anybody wants a virtual consultation. Like I said, there's many different fillers on the market for many different applications around the body. You gotta know your thickness of skin, plus the area you want to inject it, because sometimes a very stiff filler would be good, sometimes a very thin filler is better. Can Sculptra? No, Sculptra is not reversible. It is a biologic, it stimulates collagen synthesis. It lasts 2 to 5 years, typically up to 5 years, and it is not reversible. But most of the people that have Sculptra love.
Yeah, don't want to reverse.
Don't want to reverse it. It's an amazing, natural looking result, and people are super happy with that. So next week, I am not here. I don't know if you're going to be doing the live by yourself, because I will be in Utah.
Oh, man.
Yeah. So I will not be here. Happy St. Patty's Day. You want to get your St. Patty's Day hat?
Oh, yeah.
For those of you, we won't be here for that. So we got Dr. Justin and we got me for wishing you all
getting
lucky happy St. Patty's Day for next Wednesday. We will not be here. So,
all right.
We wish you guys well. And until we see you in 2 weeks. Or maybe he'll be here next week, but I don't think so. But
until next time.
Until next time.
All
Bye.
right.
Thanks for watching.
Bye.